Hello, good afternoon. This is Professor Vallin as a facilitator for Nclex preparation bootcamp from Miami Regional University. I need to ask you something that I really hate because it brings me bad memories. Can you hear me?
Yes, I hear you.
Yes.
Yes.
Okay, you can hear me. Yes, I hate it because it just remind me the times in which I was teaching online and it was not a good moment. Okay, the quarantine. Okay. As I said before, my name is Carlos Vallin, and I'm being asked by Professor Dennis to present you some information that could be useful at the moment of taking your Nclex test. As you can understand, it's impossible to teach nursing in a boot camp, in a presentation. But I think that it could be useful if we meet from time to time to discuss some aspects that we've seen in NCLEX that could be, I don't know, difficult to study and could be helpful, some kind of orientation. My school assignment is medical surgical, is med surg. Nevertheless, based in my experience with people that have taken NCLEX, I consider there are some aspects that are a little more obscure, not so frequently discussed, that are worthy of being reviewed. And I decided, at least this first time that I'm and offering this orientation, to go over some, not all, some of those aspects. I'd ask you, as you perfectly know, to keep your microphone muted, but each time that you want to intervene, you are free to open your microphones and interact. And at the moment of making question, because I'm going to present some questions in the screen, uh, I like you to make the answer in the chat board instead of doing that verbally, because then it's going to be a mess. And then after we read the questions and we try to guess the could be the correct answer of this question, uh, I try to analyze the question and to see if I can help you in some way. Okay, I want to start today talking about a topic that I see as a constant in NCLEX tests, that are legal issues and ethical principles. You know that any profession, as nursing, must have a ethical, foundation, and we have it, and we share those ethical principles with other healthcare profession, medicine, et cetera, et cetera. Those ethical principles are basically autonomy, beneficence, non-maleficence, justice, veracity, and fidelity. There are other, but those are the most important. Autonomy is probably the most important to know and to understand. In our legal system, the client, I mean the patient, has the right to know, to be informed, and based in this information to take a informed decision. So the client is not going to accept the decision from others. The client is going to make a decision by him or herself after being informed. So here is the detail: the need of inform the client, what the client needs to know to make a decision. It is true that the client can delegate in other person of his or her, confidence of the decision taking, but it is also a client's decision to delegate. But the most important is to accept that the client has the right to decide. The other two concepts are beneficence and non-maleficence. Philosophically, they are different. The first time that I faced these two concepts, I said to myself, "Oh, this is the same." Because if you are good, it's because you are not good. Bad, you are not bad. If you are not bad, it's because you are good. So beneficence and maleficence is the same. Okay, it could be the same at the end for the client benefit, but philosophically has differences. Beneficence is to do, is to act, is to actively do good for the client, including the prevention of the harm and the removal of the harm if already present. So practically everything that we do in nursing is beneficence. Non-maleficence is when we don't do harm. There is a difference between doing and not doing. And this can be translated to a scenario. And this is what Nclex does. All those theoretical concepts are translated to real life scenarios. So, for example, if, I don't know, a client has a fever and the client has prescribed a tepid water bath and Tylenol, and I give them, I'm doing good. So it could be a case of beneficence. But if the doctor tells me, please give this poison to this client because this is my mother-in-law and I hate her and I want to get rid of her, please give this poison to my mother-in-law that is hospitalized, and you say, no, I'm not doing that. I cannot do that. I cannot do harm. And it is different. You are not doing it, is non-maleficence. So to make it simple, because we're preparing for a very complex test and we cannot complicate too much. When you see in an ethical scenario that you are doing good, it is beneficence. And when you abstain, when you refrain yourself of doing a harm, it is non-maleficence, and this is the philosophical difference. I don't know if anyone has still doubt about how to face this opposite, okay, ethical principle. If you have any question, don't hesitate in doing the question now. Otherwise, we continue then. Justice is that. Everybody knows what is justice. It is the equitable distribution of resources and benefits in all the clients to be fair, etc. Take care. Take care. Justice is not communism. Justice is the fair distribution of resources and benefit between individuals, but taking on consideration the needs of those individuals. I mean, the resources that are going to require a client with, I don't know, a severe, massive myocardial infarction in cardiogenic shock are different from the resources and care that is going to require a client with, I don't know, pediculosis. So we need to have the knowledge and the critical thinking to understand that if it is true that we need to be fair, that justice is an important component of our profession, we need to make a hierarchization of the severity of the diagnosis and the client's condition, and in proportion to this hierarchization, to make the distribution of the resources. So take care. Justice is a very difficult concept in ethical principles in which you need to place in a balance, okay, both the fairness and the condition of the clients, the priorities of the client.
Ok, yo estoy dentro del meeting. Déjeme conectarme con usted remoto, Ophelia.
Ok.
Déjeme conectarme remoto con usted porque yo estoy dentro del meeting ahí ahora mismo.
We have our love tocayo, say name Carlos, with the microphone open.
Sorry,
My
Carlito.
best friend, my safe name, Tocayo, you have the microphone open.
Sorry, I didn't see my micro was open. Sorry.
It's a pleasure to listen your voice, Tocayo.
Thank you
Okay, okay,
as well.
so let's continue. So it is good stuff from the online, okay, the online meetings, okay, and I'm having a flashback. Veracity. Veracity, the name says, is the truth, is to say the truth. So whatever has to do with the truth is veracity. I am a person, as you noticed by my accent and my name, of different culture that has been translated here to this culture in my late life, my late years. Veracity is a little different in my culture than in the American Anglo-Saxon culture. My culture, sometimes veracity is relative and is accepted. It's a cultural issue. I mean, for example, I remember when taking care of clients in my culture, when very old clients, okay, an abuelo, abuela, or grandparent, had a serious disease, I perfectly remember the children, the family, telling me, "Please don't tell my grandpa that has cancer because he's very nervous and it has not any other option. It's an advanced case, and is going to suffer a lot if he knows the truth." And I remember that in those situations was correct, was considered culturally and socially and ethically correct to hide the information from the client after the petition of the relative. Okay, I need you to if you belong, as I believe many of you belong to the same audience that I come, to take a lot of care about this, because I had a lot of problems with the interpretation of veracity questions at the beginning, dealing with those veracity questions at the beginning, until I understood the veracity is much more straight and solid in this culture. That's the reason for which doctors forms in this culture are very straightforward, telling the clients, okay, the truth, and it brings a little of discomfort for some time for Hispanic, okay, relatives. Let's say those doctors were too strong saying that to my relative. No, veracity is the complete truth. Nothing is withheld, and you'll see that when we practice some question about this. So it's truth, and there is not gradations of the truth. It is absolute truth, and this is veracity, and is frequently tested in the Nclex and tested very straightforward as the truth. And fidelity is, okay, the duty to do what you have promised. If you promise something, you need to fulfill this fidelity. For example, it is a very common question in Nclex. It is a reproduction of a very common question in Nclex, which of the following is most closely aligned with the principle and concept of informed consent. And you have four ethical principles: justice, fidelity, autonomy, and non-maleficence. You had time to interpret the question, and then you know that informed consent is a legal aspect of the practice of nursing and medicine in our country that is requiring first information. So the client need to be informed. The client need to be informed of the details that are necessary to take a decision. I mean, if the client is going to a surgery, need to have information that which alternative have for surgery and which one are the risk and the benefits of this surgery. And this information is very technical. So this information cannot be given by the nurse, need to be given by the provider that is doing, okay, the invasive procedure, colonoscopy, surgery, etc., that requires informed consent. And that's why this information is given by the provider, not by the nurse. And once the client is given this information, the clients take the decision. So obviously, what is the ethical principle that is aligned, that is associated with this? Obviously, is the option C, autonomy.
Sí,
Exactly.
autonomy, self-determination.
Exactly, autonomy. Okay, because justice is not related with that. Fidelity is not related with that. In non-maleficence is not has relation with the decision of the client. So it is one example of how can be applied in a question those concepts. So let's see this question. A 60-year-old client is diagnosed with lung cancer, but the spouse is requesting keeping him from knowing he's diagnosed. Okay, it's very common that you know that you have this situation. When the nurse enters the room, or the client asks, is it true? Is asking to the nurse, is it true that I can die from what I have? Based on which ethical principle the nurse should consider answering this question. So what we have here, we have a conflict. What is the conflict?
Veracity.
What is the conflict? We have the spouse asking you, telling you, ordering you to not telling the client the information. And you need to assume, okay, a decision. If you say or you don't say. Notice the way that the questions is worded, okay? Is not asking you if you are going to say or you are not going to say that. It's just asking you which one is the ethical principle that could be related with this conflict, with this situation. And of course, it is a problem of saying the truth. And the truth is related with veracity, as you said. Absolutely. Let's see this other question. The client complains of pain 7/10. The client is known for being addicted to opioids. Doctor orders normal saline, IV, PRM for pain instead of the morphine, because doctor suspects that the client is requesting the medication because the addiction, not because it's in pain. And the doctors considers that it could harm the client continue receiving the morphine. This is the doctor's opinion. The nurse, nevertheless, the nurse questions, oppose, okay, discuss the doctor's order. Based in which of the following principle, the nurse decide to question the order: veracity, justice, autonomy, fidelity. So we have it.
The last one.
Okay. Let's do something better. Let's type in the communication board in the chat the answer, and then you give time for people that are slow like me. As you notice, I'm a very slow person because my age. Not I always have been very slow. And to really understand that better the question. Some people are like me, very slow reading the question. So what is the problem here? Did you promise the client give opioid? No, you didn't. Did you promise the doctor giving normal saline? No, you didn't. If you promise the client giving morphine and you don't give the morphine because you promise giving the morphine, then it's a problem of fidelity. But this is not a problem of fidelity. It is a problem of veracity. Why? Because if you give a person normal saline, telling the person that is requesting morphine that you are giving morphine, because each time you give a medication, you need to tell the client what you are giving him or her. You cannot give a medication without telling the person what you are giving. It is unacceptable. The patient needs to give consent, implicit consent, to receive any medication. And to receive any medication, you need to inform the client what medication is going to receive. And when you are giving this IV to this client, this IV ordered by the doctor is normal saline, and you are telling the client that you are giving morphine, you are lying. And this is a problem of veracity. So now you can accept that it's not so easy as you think. Those questions, okay, are not so easy as you think, those questions of ethical principle. And these questions that I brought here are very simple because I didn't have too much time to prepare that. I just was said very soon that I had that. I had time to find the difficult questions of ethical principle. So understand that we need to slow down, as I recommend you do in your Nclex. Don't exaggerate, but please slow down. Don't jump to your first guess and trying to analyze a second time if your answer is the best. But what we are sure has not to do with justice, has not to do with fidelity. And in relation with autonomy, the client has not autonomy to decide which medication to receive. The client cannot order the doctor which medication to receive, but the client has the right of knowing if the medication is denied or the medication is approved. So for that reason, autonomy doesn't apply, because in reality, the most commonly wrong answer that I obtain when I present this question is autonomy instead of veracity. The client has not the right, because his or her autonomy, to order the doctor which medication to receive. It is a right that is not. We have rights, and we lack of other rights. Okay, and autonomy could be the right of the client to order the medication, which is not possible. Here, what applies is veracity, because when you are using a placebo, you are lying. Placebo is unacceptable in the practice of nursing, except when it is research. In research, if you accept to participate in a research, they need to explain you, hey, you are going to be in a research of this medication. Some people are going to receive a sugar pill, a placebo. Some people are going to receive an active substance. I don't know who is going to receive each one. You won't know if you are going to receive placebo or active substance. If you accept with this condition that I'm informing you that you are going to the research without knowing what you are going to receive, active substance or placebo, then please sign the consent and participate in the research. This is the only situation in which placebo is ethical and legal in the practice of nursing and medicine. Giving placebo to a client in the regular practice, okay, lying to the client in this way without the client knowing that he's receiving a placebo is unethical and is illegal. And in the case of pain, is a serious violation of the client's rights. So pain we accept for Nclex and for nursing, that is whatever the client says it is. If the client says that is in pain, the client is in pain, and we don't judge this statement of the client because we cannot feel for the client. Okay, and in this case, it is a trap. Please don't fall in this trap in the Nclex. You need in Nclex to respect what is pain. Pain is whatever the client says it is. You cannot, judge or evaluate if the client is saying the truth or is lying. You need to accept in pain what the client says it is. It is a principle that you know because I've been taught to you, and you need to accept. And we cannot lie to the clients. A staff nurse requests vacation with 3 months of anticipation, and the nurse manager accepts the request. 3 months later, there is a severe shortage of nursing personnel, but the nurse manager authorizes the nurse's vacations. Based in which ethical principle the manager decided to allow the nurse living on vacation, now is the moment to say the last answer. Fidelity. The supervisor promised to give the vacation, okay, to the nurse. Now the nurse is asking for the fulfillment of this promise, and the promise has been, satisfied. So it is a case of fidelity. It's not autonomy, it's not justice, it's not veracity. It's just is fidelity, is fulfilling what had been promised. So it is a case of fidelity. So it is an interesting field that the way of mastering ethical principle is practicing questions. Okay, there are many more questions to practice. Okay, and we have the opportunity of doing that. Legal issues. Okay, legal issues is another, dark area in Nclex that at least I judged you by myself. When I went to my Nclex, I was not so confident about those aspects. But it's important to know, to summarize, okay, to make it practical for Nclex, okay, about the legal issues. Okay, you need to know what is the Nurse Practice Act, and you need to know what is the American Nurse Association. Because in my experience, Nclex ask you if you can differentiate, you can tell apart what is coming from the Nurse Practice Act and what has to do with the American Nurse Association. Nurse Practice Act is a law. Act is a group of laws. And the state nursing practice act includes all the legal aspects of nursing. Those are laws that are written by the legislator, okay, and this law is enforced by the State Board of Nursing. And there, in this Nursing Practice Act, we can find the most important aspects of the practice of nursing, including what in the process that you are now, the acquiring the licensure to be allowed to practice nursing, and how to keep this license, and what kind of studies, and how many hours of study you need to have, okay, of preparation to have this right, etc., etc. So this is included there. But one important aspect of the Nurse Practice Act is that this defines what is called the scope of practice, not only of registered nurses, but also licensed practical nurses and nursing assistants. So this aspect of the boundaries of the limitation of that what can be delegated to a nurse assistant, an LPN, or can be assumed by the registered nurse is included in those scope of practice. Anything that has to do with the legal aspect of the nursing practice is in the State Nursing Practice Act. Each state has a Nurse Practice Act. They're very similar, but have some variations. And of course, ours is Florida State Nurse Practice Act. The American Nurse Association includes all the nation. It's a federal, professional association. So it's like a very prestigious club of nurses, very old, with a lot of history and resources also. A very important person, okay, people with a lot of experience and knowledge, okay, direct this association. And among the professional activities that they do, it includes one that is very important, that is research. So they support nursing research, investigation of topics that are important for the practice of nurses. The American Nurse Association, for example, is the one that wrote the code of ethics that is used in the practice of nursing. And something very important is included, is determined, is written by the American Nurse Association, standards of care. What is a standard of care? Is the way of doing correctly something. So a standard of care, for example, of, let me think, weighing a client, an old client that is going to stand in a, on a stable moving balance, is that you are supposed to protect the client, okay? Because in case the client, falls, you are protecting the client to prevent injury. So it is a standard of care. The same way that is a standard of care, I don't know, to wash your hands before and after touching each client. The same way that is a standard of care, checking 3 times the medication before giving the medication to the client. And many standard of cares that we know in nursing, that the main purpose is to provide an adequate nursing care and protect the client from injury and safe. So those are standard of cares. So ethics, standard of cares, professionalization, lobbying in the legislators, etc., is a professional gremial function of the Nurse American Association. So while the Nursing Practice Act is something legal, official, the American Nurse Association is something related with the profession, the professionalization, and those are different aspects. As a consequence of this introduction to legal issue, we need to understand the concept of malpractice. Malpractice is when we do something wrong, when in the practice of our profession. So how can we do something wrong in the practice of our profession when we don't follow the standards of care? So it has been well established by research and expertise what are the standards of care in nursing. So when we practice and we don't consider and when we don't follow the standard of care, we are at risk of doing malpractice. Notice that malpractice is non-intentional. It's something that has to do more with negligence, with lack of care, with ignorance, and this kind of stuff, but it's non-intentional. And that is a negligence during the practice of the profession. That's why it's called malpractice. So for practical purposes, okay, negligence and malpractice are practically synonyms, but the difference is that malpractice is the negligence committed when we are practicing a profession that we are supposed to be trained and licensed to have the knowledge of doing the stuff correctly, following the standard of care. It's important that for legal purposes, for having a case of malpractice, we need to have 3 elements that are the most important: the duty, the breach of duty, and the damage. Duty is that you are responsible of the client, if your client has been assigned to you. Breach of duty, that you did something wrong. You didn't fulfill the standard of care. And damage, as a consequence of this breach of duty, the patient suffer a damage. This damage can be physical, can be economic, can be emotional, can be psychological, but there is a damage. If these 3 elements are present, then we have a case of malpractice, and you are liable for this malpractice. And the case will run in court. There are many, many, many questions in Nclex about malpractice, but practical questions. Once you understand what is malpractice, then you need to detect examples in which, okay, malpractice is occurring. Uh, I wrote here three situations in which malpractice applies that have been present in Nclex question. Like, for example, giving atropine to a client with glaucoma. We know that in glaucoma, we cannot dilate the pupil. We know that atropine dilates the pupil and increases the intraocular pressure and transform a chronic glaucoma in an acute glaucoma and an emergency that can leave the client blind. So because ignorance or negligence, we administer atropine to a patient with glaucoma, we are having a duty for disclosure, we are breaching the duty, and we are producing a damage to the client. So we need to have the knowledge. That's why it's required. That's why you have all those tests and all those classes and all those books and all those practice during the career, because we need to have this knowledge to be a nurse. And we are responsible of that. We are liable of not knowing that atropine is contraindicating glaucoma is not going to excuse you from a malpractice. And it is an example. Robbing the abdomen of a child with Wilms tumor is another example that I've seen in question in Nclex of malpractice. Or initiating an infusion of oxytocin in a client that is presenting, the fetus is presenting late decelerations in the monitor. So those are examples of the way that is tested. This is the way that is tested. Good Samaritan Law is also present frequently in the Nclex, as you know. What you need to know about Good Samaritan Law is that it applies outside the hospital, not in the medical facilities, and it is required. The requirement is that it is an emergency, and you need to practice, the help in those emergencies without committing gross negligence. So again, malpractice can occur in the providing care in situation of emergency. And those are the questions that are more frequent. So, for example, you stop in an accident and you move the client without stabilizing the neck. It is an example in which the Good Samaritan Law is not protecting you. Why? Because you committed a gross negligence. And another example of question has been that you have a patient with an arterial bleeding and an active bleeding, and you are using a very dirty, cloth to make pressure over the wound. So those are gross negligences. And when the nurse commits this gross negligence in helping in case of an emergency, the Good Samaritan Law doesn't apply. So this is the main concept that you need to know, that Good Samaritan Law protects you from being sued in case of stopping for an emergency, except those situations. There is gross negligence or there is abandonment. Abandonment is when you abandon, the client. Okay. For example, you are in your shift, you are working in the hospital, and they called you that that your house is on flames, and then you abandon your shift and you go to your house, to see what you can rescue from the fire. In the end, you don't tell anybody that you abandoned. Nobody has been, given the care of your clients, and you abandon because you have a very serious situation. You abandon your shift. It is a question in English. I saw this question in the English, and this is abandonment. But also when you stop to help somebody in emergency and the rescue delays in arriving, and you abandon, you leave. This is abandonment. So this is another situation in which the Good Samaritan Law is not protecting you. And the last is, and have been also in question, is compensation. You cannot receive compensation because you stop to provide help in emergency. And can be very, tricky because, for example, there is a question in which the nurse accepted a new scrub from the client, from the family of the client, when they stopped for helping because the scrub got, soiled during the action of helping the client. And this is accepting compensation. So you cannot accept any kind of compensation. So have that in mind to deal with questions of legal aspect of Good Samaritan Law happening in the English. So let's see this question. The scope of nursing practice is legally defined by State Nursing Practice Act, professional nursing organization like American Nurse Association, hospital policies and procedure manuals, physicians in the employing institution. So easy question. This is the way that straightforward the Nclex can ask you if you understand from where is coming the legal aspects of the practice of your profession. And of course, the right answer is A, the State Nursing Practice Act. The Code of Ethics for Nurses is composed and published by, now is not a legal issue, it's a moral issue. Ethics is this conflict between your eros and thanos, your good and your bad. This is a moral issue. So when you are alone with a client and in a room and the client is unconscious and you do the correct, okay, with this client is the ethics what is prevailing there, okay? And of course, the ethics is not legal, is moral, is in the code of ethics. So now the answer is American Nurse Association because it's a professional issue. So now you can see how could be tested in English, which is very common, if you understand from where comes the legal aspect of your practice of your profession and from where comes the ethical standard of care, research, knowledge, professionalization, mode of correct behavior of a professional, looking nurse, etc., come from the American Nurse Association. And once you understand that, you won't have problems understanding because the questions are very straightforward. A 65-year-old female client arrived to the ER with chest pain. The nurse accidentally administered 10 milligrams of morphine sulfate instead of 4 milligrams as prescribed by the healthcare provider. So it is a medical error. It's a problem of calculation. It happens when the nurses don't understand mathematics, okay? That's why it's so important that you master basic calculation because many times you need to make calculations that can make the difference between life and death. And if you don't understand that, it's unacceptable. Later, the client respiration rate is 11 breaths per minute. A little slow, but not critical. Oxygen saturation, 98%. You know that this saturation is perfect. And the client is alert, and she states that her pain has subsided. She's very happy with the shot that received from you, the overdose that received from you. So now they are asking, what is the legal status of the nurse? So of course we have here a medical error. We have duty because it was the client, but we have a breach of duty. But the third element is present. There is a harm, there is a damage, there is a consequence for the client. So obviously, from the legal point of view, the third element, which is the injury, the damage in the client, is not present. For that reason, even if it is a medical error and need to be reported, corrected, etc., legally, that reason, even if it is a medical error and need to be reported, corrected, etc., legally in court, there is no case. Why is there no case? Because there is no harm. The client cannot prove, harm. And because the client cannot prove, harm, the client will not be able to prove malpractice in court. What is the situation of this nurse? This nurse committed a serious mistake. What must do this nurse committing this mistake? First, once the nurse realizes the mistake, the nurse needs to go to the most important person here, which is the physician, no, the client. She needs to go to the clients and assess the client and provide the first aid to the client. So this nurse needs to have the knowledge that this morphine have two main consequences. This overdose of morphine has two main consequences to the clients. Can produce a depression of the central nervous system, including the respiratory center, and can produce hypotension, because are the two main acute side effects of the opioids. And obviously, the nurse did that. Okay, so this is the first to do: assessment of the status of the clients and providing the first aid necessary. First aid necessary are going to be to support ventilation, to administer an antidote if it is pertinent, and keeping the patient on bed, avoiding the patient having orthostatic hypotension, raising the legs, and doing all the first aid. This is the first to be done. So if they ask you what you do first, if it happens, is you go to the client, assess the client, and provide the independent and collaborative nursing interventions that are going to help the client in this situation. It is a possible question in English. So what is the next that you need to do after you stabilize the client? You provide all what can you give the client to minimize the consequences of this medical error. You communicate what happens to the doctor, the provider, and the provider will give you instructions. Once you carry out those instructions, in this case, now you document what happened. The documentation needs to be done in the client's chart. Yes, you need to document that this dose of morphine was given. At the moment of documentation in the client's chart, in the document that the clients that reflects all what happened in the clients, you need to follow certain rules. You need to be factual, and you need to be detailed. So notice these two words because it's going to be very useful at the moment of documenting, because in Nclex you will have different documentation, different examples, and you need to decide which documentation is the best. There are two requirements that are important. Need to be factual, facts, not interpretation, facts. And second, need to be detailed. So for example, a good documentation could be date, time, and morphine sulfate. 10 milligrams IV administered to the client. This is the fact. This is what happened. You administered 10 milligrams of morphine to the clients, and you document 10 milligrams of morphine sulfate administered at IV to the clients in that moment. You don't write, by mistake, I gave 10 milligrams of morphine instead of 4 milligrams are prescribed by the healthcare provider. Because this is now interpretation. Yeah, this is your interpretation of the situation. That, by the way, is correct, but you could not, write there interpretation, only facts. What happened is that you gave 10 milligrams of morphine. Of course, anybody that goes to the doctor's order, you are going to find that what was ordered were 4 milligrams, and it is evident there. The next that you need to document is how the patient reacted to this dose of morphine, and what did you do for the client to support the client, for the benefit of the client, for the beneficence of the client. And then you document that you communicated with the doctor and the provider, and the provider orders. Once you do that is when you are going to write what is called an incident report or variance report. Take care, because incident and variance report is the same, because it's a variation of the routine. So it's not a routine that you commit a mistake. And for that reason, it's also called a variance report. Incident report and variance report is the same. Why I say that? Because in Nclex has been written variance report, and if you don't know that it's the same as incident report, you don't know. In this document, which is apart, is different, is separated from the client's chart, you are going to document what happened, and you are going to answer questions that are asked in these documents. This document is created by risk management, a part of the institution that take in consideration that mistakes occur and study those mistakes and collect data information of those mistakes with the purpose of preventing those mistakes. This document is a part of the client chart and is not mentioned in the client chart and is sent directly to risk management. But before doing the incident report, you need to document in the chart all this stuff. I give you all this precise information because all these details have been tested in Nclex. If you know how to deal with a mistake and a incident report. So the nurse calls a physician regarding a chain of client's condition. The physician gives an order over the telephone for normal saline with potassium, which is the most important safety consideration when obtaining this order. So what is the detail of this question? That is a reproduction of one that, similar that was in Nclex, that it is a telephone order, a very common situation. So you need to know that in telephone orders, there is a high risk of committing a mistake because you are receiving the order verbally. And verbally, especially with people with accents like I have, it could be misunderstood, the order. So what is the most important? That when you receive the order, you write down the order. But then after you write down the order, without interrupting the communication, you need to read back to the provider, and the provider need to approve when you read back that it was exactly what he said. Okay, so that's it. It is the option A is the best answer for this question. When you have a situation in Nclex in which you have a doubt in the prescription, so they present to you in a scenario where you have doubt in what the patient ordered. For example, is missing the route, or the dose is not the dose that you consider is appropriate, etc. The first person with whom you need to clarify the order is with the prescriber, not the nurse supervisor or nurse manager, not the pharmacist, or not any colleague, any other nurse. The person who needs to call to clarify this doubt is the provider. This is the questions that we've seen in Nclex, okay, is the concept that is explored. If you know to whom you need to clarify. Don't forget that when you are giving a medication, when you are carrying out a doctor order, you need to do 3 checks. So when you have an order of a medication and you read this order, and you go to the place where this medication is stored, because the medication needs to be stored someplace, in a pixel, in a cart, in nurse station, whatever, and you retrieve the medication, you are going to do the first check. You are going to contrast the doctor order with the medication that you are retrieving from the storage. This is the first check. Then when you prepare the medication, okay, in the amount that has been prescribed for the client, you do your second check. So it's when you pop out to your pour the medication, or you retrieve the medication with syringe, and you prepare the medication. The second check, you contrast what the doctor ordered, medication X, dose B. So you contrast, okay, the 2 orders, that everything is correct. And the third check is when you go at the bedside with the doctor order. So you need to carry with you the computer, if it is an electronic record, okay, or the paper bag, okay, in form of MAR, medical administration record. And then when you offer the medication to the client, before offering the medication to the client, before explaining the medication to the client what medication is receiving, you need to check again the doctor's order, the prescriber order, and the medication. And you know the right, the right medication for the right client, the right time, the right route, and the right dose, and all the right documentation, etc. The secondary rights. In which situation should the nurse manager intervene? Okay, a classical question would you say something is wrong, because if the nurse manager needs to intervene it's because something is done wrong in observing a new graduate nurse administering a medication. So you have this first situation. The nurse brings the MAR, medical administration record, is MAR. As I said, can be a computer if it is electronic, or can be a paper if it is physical, like in the long, in the, ¿cómo se llama esto? In the nursing cares, in the nursing care, no, nursing homes. The nurse brings the MAR to the client's room with the drug to give. B. So we're looking for the wrong, and this is not wrong. We can rule out this option because we know that it is correct. The nurse asks the client to state first and last name before giving the drug. The nurse doesn't wear gloves to administer antiviral to hepatitis B client. And the client doesn't check blood pressure before administering dioxin. Okay, so now we have here a situation. So we can rule out A because we just mentioned that it is correct. Okay, so we need to decide what is wrong of these three elements. I don't know what you think about a nurse that is not checking the blood pressure before administering dioxin. Dioxin is an inotropic positive medication with high toxicity. So because the toxicity requires a evaluation before giving the medication. The main way of recognizing dioxin toxicity is asking for digestive symptoms like anorexia, nausea, vomits, visual symptoms like blurred vision or halos of color around the object. And the third is measuring what? The heart rate, the apical pulse, the heart rate auscultated in the apex. If it is less than 60 in a volt, you know that we withhold the medication. We don't give the medication. We call the provider because we suspect toxicity if it is less than 60. So blood pressure is not needed because blood pressure is not modified by dioxin. And this is the way of ruling out this, okay? Applying knowledge that we have. So we rule out this. This, what I'm doing in this moment, is the best technique to find the right answer or to the best guess in case of a little tricky questions, okay? Ruling out what we know well will improve our possibility of getting the right answer of a difficult question. So now we are left with two options only that need to be decided. That the nurse doesn't wear gloves to administer a medication to a client to hepatitis B. Okay, antivirals are, oral medication given to hepatitis B. Or the nurse is asking the client to state the first and last name before giving the drug. So I'd like one of you to guess which one is the answer of this question, once that we reduce the possibilities. What is wrong here? What do you think?
C.
Okay, for deciding about C, we need to have a knowledge of infection control. In infection control, we need to know that there is a mandate that is unique. We need to wash our hands before and after interacting with the client. It is standard, okay? But in some situations, okay, we need to add to washing our hands before and after touching the client, we need to add gloves. Which one are those situations? There are two reasons, two indications of wearing gloves to touch a client. First, is standard precaution when we are going to be touching body fluids, I mean blood, genital fluids, feces, urine, etc., or when we are touching mucosa, I mean eyes, nose, mouth, genital, anus, colostomies, or open skin, I mean wounds, rashes, etc. For standard precaution, which apply to everybody, we only wash our hands before and after touching a client, okay? But we wear gloves if the client we are going to touch body fluids, mucosa, or open skin. Obviously, if it is for standard precaution, we don't have to wear gloves in this scenario. But the other cause of a mandate of wearing gloves is that the client is in contact precaution. Contact precaution. You know that for infection control, every very is standard precaution. Every very. But some, not every very, some people, a part of standard precaution, need isolation. Isolation. And this isolation has 3 levels: contact, droplets, and airborne. So if the client, a part of the standard precaution, is in isolation, either because of contact, droplet, or airborne, we need to consider if it's need of gloves. The only isolation that require gloves is contact isolation. So we need to decide if hepatitis B is requiring contact precaution. Okay, so we don't need isolation in contact precaution for hepatitis B. For any hepatitis, okay, hepatitis B doesn't require contact isolation. So there is no need of isolation in hepatitis B. So there is no need of wearing gowns and gloves, which is the requirements, PPEs, or personal protective equipment, in contact isolation in hepatitis B. And by a standard precaution, the hepatitis B is, yes, a standard precaution. If we are touching the body fluid, the mucosa, or the open skin of this client of hepatitis B, we need to wear gloves. Otherwise, being hepatitis B only standard precaution, and we don't need to wear gloves because we are not to give a tablet of acyclovir to the client with hepatitis B. We don't need to wear gloves. So basing my knowledge of infection control, which is one of the most important aspects for Nclex, the client, the nurse does not need to wear gloves to administer an antiviral to hepatitis B. So need to be B. The answer need to be B. Even if I don't know why, based on the knowledge that I have, that I bring the MAR to the client's room, that I don't need blood pressure for give dioxin, and my knowledge that hepatitis B is a standard precaution, to give a tablet to standard precaution, HIV, hepatitis B, hepatitis C, I don't need to wear gloves, only wash my hands before and after. The answer needs to be B. So what I use here on a strategy, because I don't know the answer straightforwardly. I don't know the answer to this question. So what I did, I rule out what I just know, what I do know. Okay, now let's analyze why what is wrong here is option B. Anybody knows why is wrong option B?
Check the bracelet.
Because we need two identifiers before the
identifier, and it's asking only for one identifier. Name and last name is one unique identifier, but it's missing the second unique identifier. The classical is the date of birth, but could be the record number that is in the armband, etc., etc. Never the room number. Never the room number. Please, very important. It's a common distractor. Never the room number is or the date of birth, something unique for the client. Okay, so what is wrong here? Why the nurse might need to intervene? Because this nurse is not sure that the John Smith of Juan Perez that is given the antiviral medication is not the same John Perez that has been prescribed, or Juan Perez, or John Smith that have been prescribed the medication, because there could be two Juan Perez or John Smith in the floor, because it's a very common name. So first and last name is not enough. So that's why this is an example of question. Okay, so please, it's important that you know that it is a very important question, guys. If the Nclex is evaluating if you are a safe nurse to give you the license, and you fail in something so basic as the correct identification of the client, do you think that the Nclex will allow you to pass, not knowing, not demonstrating that you know how to correctly identify the client? So think a little about the importance of this legal BS, whatever you want to call, part of the content of Nclex that you need to be prepared with that. Because I know that you have been dedicated a lot of time to my specialty, to med search, etc. You know the difference between Cushing and Addison, etc. But those aspects are the fundamentals of nursing. And safety is the foundation of the fundamentals. And please, with this example of question, assume the rigor or the importance of knowing those basic stuff in nursing, like client identification, the rights of administration of medication, etc. Because when we fail in those basics is when we place the client at risk. And Nclex is just a test to know if you are a safe nurse. Nclex doesn't care too much about your knowledge unless this knowledge is necessary to protect the client, to guarantee the safety of the client. So once you understand the philosophy of the Nclex, it guides the way that you study. And this confusion, these clouds that you have, this fog that you have in your brain when you're studying with so much information, start acquiring certain organization and certain prioritization. So I think that for Nclex, there are some basics that you cannot afford not knowing. There are other aspects, guys, that in my experience with people taking the Nclex, that it looks like Nclex don't pay too much attention. So if you failed some questions about what is the desired outcome of giving the medication or Orlistat to a client, and you fail this question, I think that the Nclex is going to ask you another question, but you are not going to fail the question for that. And I've seen people passing the Nclex with 75, with minimum passing the Nclex, committing mistakes. So, but there are mistakes that have been committed, and there are mistakes that cannot be committed. It is a mistake that you cannot commit. You cannot fail identifying a client because it's something basic. It's something that is going to make very difficult for you to pass the Nclex. You know, this SBAR, situation, background, assessment, recommendation, frequently testing the Nclex is very simple. It's the way of communicating effectively and safely between the different members of the multidisciplinary team. And you know that SBAR, what means is trying to organize, okay, you know, sometimes in my case, I'm this way, I'm very disorganized when I communicate to the people. So for that reason, I need to have certain disciplines that organize myself. So when I'm communicating a situation to other members of the team, suppose that I need to call the provider because the patient has a change of condition. So the information that I'm providing to the physician that probably is waking up at 3 a.m. and is a little confused, is very disoriented because of the time. And the information that I need to give him, I must give him or her, need to be very precise and organized. So that's why the reason of SBAR. So situation, background, assessment, and recommendation. Very easy. Situation, what is happening. Why you are calling at 3 a.m. the physician? Because there is a situation. There is a change of condition. Or maybe it's not so severe. Maybe it's something that you need to communicate to the dietitian, that the patient is not tolerating a certain component of the food. So this is the situation. The patient is not tolerating, some food. And the background is the pertinent, not everything, not all the chisme, not all the gossiping. Okay, the pertinent past information to the situation. So if you are calling the doctor about a patient that has fever, but the patient has a recent surgery, it is super pertinent because we know there are specific infections that are more common in the post-operative period. And if the client has a food allergy that in the background that is related with the intolerance that is presented with the food that is brought by the dietitian, it is pertinent. This is the background. Assessment what you objectively and subjectively found in your assessment. Okay, and it's pertinent. Okay, don't give all the information, only the pertinent. And then the R is the recommendation, your analysis, what you suggest, what you ask for help, etc., etc. Okay, so it is going to be applied to situations that are specific. For example, the nurse called the doctor because a client is dehydrated. So it is a situation. A client was not dehydrated and now is dehydrated. The nurse tells the doctor the patient has type 2 diabetes, which is a condition that when decompensated produces dehydration. But this history is background. Which part of the S-bar model is the last statement? The diabetes background. Of course, is background. The situation is the dehydration. The background, the patient is diabetic. If you make an assessment of the skin turgor or the change of weight or blood pressure, is this assessment and your recommendation, what you suggest, what you ask, the help that you are requesting. The other one, the nurse tells the doctor a post-operatory client had fever when she checked him for feeling warm. Which part of the S-bar model is this stemming? Okay, the patient has a fever. Okay, the patient has fever when she checks the client. Okay, is the situation. Okay, and what is the surgery background? Okay, if you measure the temperature in all the parameters that are more objective, is the assessment and the recommendation what you ask. Here is written what I previously told you, because in Nclex you are going to have this type of question, like this one that is here, for documentation of a scenario. And they are going to ask you which one is the best documentation, how you could document that. So you have here a question, say a child with a fractured femur is brought to the ER by the parents. The parents say the child fell off the sofa. On examination, the nurse finds several blistered areas on the child's buttocks. Which is the appropriately formed, the nurse should document this finding. So notice that the question could distract you to the area of abuse, but the question is not about abuse. The question is about correct way of documenting. So now you have for documentation, and you have, several way of saying that. You need to look for what is factual, facts, not interpretation, and detailed. So obviously, when going from the bottom to up, when you see the word several, it is not detailed, because several can be 3 or can be 30. So it is disqualified the options, okay? And what is appeared to be cigarette burns, an interpretation. So it is a perfect example of what not is correct. Okay, when you see not in buttocks, okay, but okay, which part of the buttocks? Okay, blistered and redness skin noted on buttocks due to unknown causes. This statement, due to unknown causes, is another interpretation. Okay, another interpretation that could not be accepted. Okay, how many blistered redness areas are present? Is detailed, is not detailed. So this is the qualified. Multiple is the same as several. Could be 3, could be 30. Small, what is small? What is small for you? Burn marks. Did you see the client being burned? Are you sure those are burn marks? Is this your interpretation or is factual? It disqualified. That's why the best option is the first. I know that is a very easy question. Okay, it could be easy, could not be easy, but it's good to understand facts and details. Do you see in the first option any interpretation? Okay, no interpretation, just description. The person that is reading this must interpret that and decide, okay, what to do. But there are 6 measuring that are red and has blister and are unbuttered, okay? And this is the best documentation. An example of how can be tested this comes in. A young female, another example, a young female arrived, let me move just a second. How can I move okay, here. A young female